Every 40 seconds, someone in America has a stroke. And here's the part nobody tells you. Most people feel it coming. There are warning signs. There are precious minutes. And what you do in those minutes can be the difference between walking out of the hospital on your own 2 feet or not walking out at all. But here's what breaks my heart. Most seniors don't know what to do. They sit down, they wait, they think it'll pass. And by the time the ambulance arrives, the damage is done. Today, that changes. A board-certified neurologist and internal medicine physician with over 2 decades of experience treating stroke patients. From emergency rooms to rehabilitation wards, I've held the hands of patients who made it, and I've had the heartbreaking conversations with families of patients who didn't. The difference often wasn't the severity of the stroke, it was what happened in the first 3 minutes. And I want to share everything I know with you today, for free. Because this information shouldn't be locked behind a $200 consultation or a pharmacy shelf full of supplements nobody needs. I do need to say this clearly. I am not your doctor, so please consult your physician before making any changes to your diet or medical regimen. What I'm sharing today is education. Powerful, potentially life-saving education. But your personal doctor knows your history, and they need to be part of your plan. Now, let's talk about saving your life. In the next several minutes, I'm going to walk you through 5 science-backed strategies that could mean the difference between life and death during a stroke emergency. You'll learn the exact 3-minute technique that buys critical time before the ambulance arrives. You'll learn how to recognize the silent symptoms that most people completely miss, including one that only presents in women. You'll learn the single most important thing you must never do when you feel a stroke coming. And you'll leave with a simple, clear action plan you can start using today. No expensive equipment, no pills, no gadgets, just knowledge, the most powerful medicine there is. Let's start here, because if you can't recognize a stroke, nothing else matters. You've probably heard of FAST, face drooping, arm weakness, speech difficulty, time to call 911. That's a good start. But it's not the whole picture. And for seniors, especially women over 65, relying only on FAST can be dangerous. A 2016 study published in the journal Stroke by researchers at the University of Michigan found that women experiencing strokes were significantly more likely than men to present with what are called non-traditional symptoms, things like sudden hiccups, sudden nausea, a sharp, unusual pain in the face or chest, sudden shortness of breath with no obvious cause. The study found these atypical symptoms occurred in roughly 60% of female stroke cases. Yet fewer than 40% of women in the study recognized them as stroke warning signs. So here's what you need to add to your mental checklist. Beyond the classic face, arm, and speech signs, watch for a sudden, severe headache, not a normal headache, one that feels like someone hit you in the back of the head with a sledgehammer. That's called a thunderclap headache, and it's a red flag. Watch for sudden vision changes in one or both eyes, sudden confusion or trouble understanding what people are saying, and sudden dizziness or loss of balance for no reason. Here's the practical takeaway. Write these down and put them somewhere visible, your fridge, your bathroom mirror. Better yet, take a photo of this list right now. Because when a stroke is happening, you won't be searching Google. Your brain will already be under pressure. You need this knowledge automatic, instinctive, already there. The moment you notice even one of these signs, even if you're not sure, we move to the next strategy immediately. This is the centerpiece of today's video, the technique that genuinely saves lives, and it costs nothing. When you feel stroke symptoms coming on, your instinct might be to sit down, drink some water, and see if it passes. I understand that instinct. Nobody wants to be the person who called 911 over nothing. But here's what you need to understand. Ischemic strokes, which account for about 87% of all strokes according to the American Stroke Association, are caused by a blood clot blocking blood flow to the brain. Every minute that blockage continues, you lose approximately 1.9 million neurons. That's not a metaphor. That's a published figure from a 2006 study in the Archives of Neurology by Dr. Jeffrey Saver at UCLA. He calculated that for every minute a stroke goes untreated, the brain ages the equivalent of about 3.6 years. 3 minutes of hesitation can cost you a decade of brain health. So here is the 3-minute response protocol. Minute 1, call 911 immediately. Do not drive yourself. Do not have someone drive you. Paramedics can begin assessment and notify the hospital while en route, and research from the American Heart Association shows that patients who arrive by ambulance receive clot-busting treatment, called TPA, up to 60 minutes faster than those who arrive by private vehicle. 60 minutes. That's enormous. While you wait for the call to connect, or immediately after, unlock your front door. This sounds small. It is not small. Emergency responders lose critical minutes when doors are locked. One simple action, right then, could save several minutes of treatment time. Minute 2. Do not eat or drink anything. Not water, not a snack, nothing. If surgery or treatment is needed, food or liquid in your stomach creates serious complications. Many well-meaning family members hand a stroke patient a glass of juice, and it delays critical care. So, nothing by mouth. Minute 3, lie down on your side, not your back. If you feel nausea, which is common, lying on your side prevents aspiration, which means preventing you from accidentally inhaling vomit into your lungs. If someone is with you, have them stay on the phone with the 911 dispatcher, who will guide you step by step. Stay calm. Controlled breathing. Slow in through the nose, slow out through the mouth. Can help regulate blood pressure slightly in those critical moments. And blood pressure management in the first minutes matters. That is your 3-minute protocol. Call, unlock the door, lie on your side, nothing by mouth, breathe. Practice this mentally. Walk through it in your head tonight before you sleep. Because when it's real, you will not rise to the occasion. You will fall back on your preparation. Before we continue, I want to ask you something. Do you believe that life-saving health information should be free? That seniors shouldn't have to spend hundreds of dollars on supplements and programs just to get access to basic knowledge that could save their lives? If you believe that, comment below, "I deserve the truth." Because that's exactly what this channel is about. Not selling you something, not pushing you toward a pill or a product, just honest, evidence-based information. The kind your doctor wishes they had 45 minutes to sit down and share with you. Comment, "I deserve the truth" right now, and keep watching, because the next 3 strategies are just as important. High blood pressure is the single most significant modifiable risk factor for stroke. The American Heart Association estimates it's responsible for approximately 54% of all strokes worldwide. It's called the silent killer for a reason. It has no symptoms until it causes catastrophic damage. But here's what most seniors don't realize. Blood pressure isn't just a number you check once a month at the pharmacy. It fluctuates dramatically throughout the day, spiking with stress, with cold weather, with waking up in the morning. A 2020 study from the University of Alabama at Birmingham found that morning surge, the rapid rise in blood pressure in the first hour after waking, was associated with a significantly higher risk of stroke in adults over 65, with some high-surge patients showing up to a 30% increased risk compared to low-surge patients. So what does this mean practically? It means your morning routine matters enormously. Do not leap out of bed. Seriously, sit up slowly. Give your body 60 seconds to adjust. The simple act of standing too quickly causes blood pressure to spike and then drop, a phenomenon called orthostatic hypotension. And that cardiovascular stress in the morning, repeated daily for years, adds up. It also means if you take blood pressure medication, take it consistently. Same time, every day. Not roughly the same time. The same time. Consistency in medication timing is associated with meaningfully better blood pressure control, and your pharmacist can help you build a system that makes this automatic. And here's something you can do completely free, starting tonight. Check your blood pressure twice daily, morning and evening, and write it down. Not to panic over the numbers, but to notice patterns. Does it spike on stressful days? Is it consistently high in the mornings? That pattern is information your doctor can use to dramatically reduce your stroke risk. A $20 home blood pressure monitor and a cheap notebook could be more valuable than any supplement on any pharmacy shelf. You've probably heard that aspirin can help during a heart attack. Many seniors assume the same is true for strokes, and they keep a baby aspirin nearby just in case. Here's where I have to be very careful with you, because this is one of those places where the wrong information can genuinely cause harm. For ischemic strokes, clot-caused strokes, aspirin's role is complicated, and timing matters. But for hemorrhagic strokes, strokes caused by a bleeding blood vessel in the brain, which account for about 13% of strokes, taking aspirin during a stroke event can make things significantly worse. Aspirin thins the blood. If the brain is already bleeding, blood thinning is catastrophic. Here's the critical point from a 2019 review in The Lancet Neurology. Without proper imaging, it is impossible to tell from symptoms alone whether a stroke is ischemic or hemorrhagic. The symptoms can look identical. So what does this mean for you? Never take aspirin on your own during a suspected stroke unless your doctor has given you very specific prior instructions to do so. This is not the moment for improvisation. Call 911. The hospital has CT scanners that will identify the stroke type within minutes and administer the right treatment. If your doctor has already prescribed aspirin as a preventive measure for you, continue taking it as directed. That's a different situation. Preventive aspirin under medical supervision has strong evidence behind it. We're talking about the moment of crisis, where guessing wrong can cost everything. This is exactly the kind of nuance that gets lost when you're buying advice from a supplement website. They want to sell you a stroke prevention kit. What you actually need is a conversation with your physician about whether preventive antiplatelet therapy is right for your specific situation, not a one-size-fits-all bottle with a dramatic label. I want to end the main content with something that feels genuinely hopeful, because everything we've talked about so far has been reactive. What to do when something goes wrong. But the most powerful stroke intervention isn't a technique or a protocol, it's your daily life. A landmark study published in The Lancet in 2016, analyzing data from over 26,000 participants across 32 countries, called the Interstroke Study, found that 10 modifiable risk factors account for approximately 90% of the population attributable risk for stroke. 90%. And the researchers calculated that addressing those factors could potentially reduce stroke occurrence by up to 80%. 80%. Think about that. Not 10% or 20%. 80. The factors at the top of that list were hypertension, which we already discussed, physical inactivity, poor diet, smoking, and abdominal obesity. And here's the remarkable thing. None of these require expensive interventions. They don't require a specialist. They don't require a supplement subscription. 30 minutes of walking, 5 days a week, is one of the most evidence-supported stroke prevention interventions in the medical literature. A Mediterranean-style diet, olive oil, fish, vegetables, legumes, fruit, nuts, was associated in a landmark Spanish trial called PREDIMED, with a 30% relative reduction in major cardiovascular events, including stroke, compared to a low-fat control diet. 30%. From food you can buy at any supermarket. And sleep. Do not overlook sleep. A 2019 meta-analysis in the journal Neurology found that both short sleep, less than 6 hours, and long sleep, more than 9 hours, were independently associated with significantly elevated stroke risk. 7 to 8 hours appears to be the protective window, not because of any pill or supplement, because your body heals, regulates blood pressure, and clears metabolic waste from the brain during sleep. A system called the glymphatic system, essentially the brain's overnight cleaning crew, is most active during deep sleep. You do not need to be perfect. You do not need to overhaul everything at once. Pick one thing from this list. Walk tomorrow morning. Have fish for dinner this week. Go to bed 30 minutes earlier tonight. Stack these habits slowly, consistently, and you are doing more for your stroke risk than any product sold with fear-based marketing ever could. Let's bring it all together into something you can actually use. Your stroke response action plan starts with knowing all the warning signs, not just fast, but sudden thunderclap headache, vision changes, sudden confusion, unusual nausea or hiccups, especially if you're a woman over 65. When symptoms appear, follow the 3-minute protocol. Call 911 immediately, unlock the door, lie on your side, nothing by mouth, breathe slowly. Never take aspirin during a suspected stroke without prior physician guidance. You cannot tell at home whether the stroke is ischemic or hemorrhagic. Monitor your blood pressure at home, morning and evening, and share the pattern with your doctor. And for prevention, walk, eat well, sleep 7 to 8 hours, and work with your doctor to manage blood pressure with consistency and intention. Print this out. Save this video. Share it with someone you love who needs to hear it. I want you to take one thing away from today more than anything else. Knowledge is the most powerful thing you have. Not a supplement, not a device, not a $300 program. Knowledge that you've practiced, internalized, and that lives in your hands when the moment comes. Stroke is terrifying, but it is not a mystery. It responds to preparation. It responds to speed. And now you are more prepared than the vast majority of people watching this. In the next video, I'm going to walk you through the 5 silent symptoms that predict a stroke up to 7 days before it happens. Signs your body sends that most people completely misread. That video could be the one that changes everything for you or for someone you care about. So make sure you're subscribed, just tap the button below and turn on notifications so you don't miss it. If this video helped you today, please share it with one senior in your life, one person, one share. That simple act could be the most important thing you do this week. Take care of yourself. You deserve to.